Hey guys, welcome back to Friends and Enemas. My name's Lindsay, and I have one of my favorite guests with me today, my friend Anna. You guys know Anna. She was on season 1. Let's say hi.
Yeah, season 1. It was great.
Yeah.
Thanks for having me again.
Kind of getting back into the flow of things. So
Yeah.
I wanted to bring you on because there will be a future episode about some things that I don't fully understand that could happen with labor and delivery. Don't want to spoil it for anyone, but Anna's on that one too. But I figured we could kind of do like a Q&A with you on this one.
Sounds great. Let's do
All
it.
right, let's run into it. If you don't know Anna, she is labor and delivery. Anna the nurse. She's been in it for how long?
11 years, labor and delivery. That's where I started.
Okay.
That is where I will end.
Okay, you
That's
love
my
it.
plan. I love it.
Love I've never met a labor and delivery nurse that hates it.
Good.
No, truthfully.
That's good. They shouldn't. If
Right.
you hate labor and delivery and you're in it, you probably shouldn't be in it.
You probably should leave.
Yeah, you should probably.
But I feel like in every other
Other department.
you hear how much people hate it.
That is true.
I don't
That
hear
is
it with labor and delivery. I really don't.
Yeah.
I'm sure there's somebody out there, but like, I don't know about them. I couldn't put them out. So anyway, I went on my Instagram and I put a question box up for the viewers/followers to send in some questions. So I have 20-ish plus questions for you here. Then there were a lot more, but this is kind of condensed. So just going to rapid fire and let you answer them.
Let's do it.
All right. How to start in labor and delivery or mother baby as a new grad?
Okay, so it's not an easy answer. I know a lot of people are like, it's so hard to get into labor and delivery. All I can say is that if you're truly interested and you want to do labor and delivery or mother baby, 1000% do an internship if they offer that at your school, and you have to like pay to work.
Yeah. Yeah.
And I remember doing it and like paying like $1,000, and I'm like, I'm working on
Yeah.
labor and delivery. I'm like, oh my God, I'm already a poor college student. But
I'm already in debt.
yeah, but that absolutely got my foot in the door, and you learn so much from it was called a preceptorship. It was the rural California preceptorship, and I learned so much more doing that than I did at any clinical in nursing school. I don't know if you do an internship in nursing school, or you just like...
I didn't, because I was a broke college student and I was like, I have to work. But lots of my friends did one.
Yeah.
I don't know the difference between intern or extern, but some did externship, some did internship.
Whatever you can add to your resume, especially if they take you in for like a month. That's what I did. They took me in for a month. I did it during summer, and you basically shadow a labor and delivery nurse. And obviously if they have that program, I would assume that they would assign you to a nurse that likes students.
You would hope.
You would hope.
One would hope. I do feel like you do have to just, I guess before, like if you hear that the unit you went on doesn't take new grads, it's important to ask the manager directly. Because sometimes it's a rumor.
Yeah, I think it is important to ask the manager.
Like
get a
sometimes
hold
you
of
just
them.
hear like L&D doesn't take new grads. I don't think that's true across the board. It's just
it's not.
depends on the unit. Just like ICU doesn't take new grads, you have to start in med surg. That's definitely not true. You just have to know what your hospital's unit decides. And so send the manager an email.
Yeah.
Meet them in person.
Yeah.
Kiss their booty just a little bit,
Right.
like kiss butt if that's where you're trying to be.
So I actually, on my Instagram, every year I put a question box and I say, basically, if you work at a hospital that accepts new grads, let me know what they are. And then I screen record them. I get the answers, screen record them, and I put them on a highlighted story. So if you're looking and you're willing to like move, I've tons and tons of hospitals on that list. So check out my Instagram.
Yeah, yeah. This is a question I got a lot, and I put it on here as number 2 because I know your unit is not like this. Is every L&D unit toxic?
Well, clearly you're going to have your toxic ones and your non-toxic ones, but okay, I'm not going to lie, but I hear people say L&D nurses are known to be kind of bitches.
Yeah.
I don't know if that's what you hear, but
So in the thread of these questions, tons of them were very much like this. Like, I work on a really toxic unit. All my L&D nurses are mean, and I don't like to generalize.
Right.
It's definitely, it can happen.
Yeah.
But it's definitely not all or even most, I would say.
Yeah, well, when I even heard that, I was like, wait, what?
Yeah.
I've never heard of that. What? I'm like so
Maybe it's you.
oblivious.
No, I'm
Maybe
just kidding.
right? Yeah, right. Is it me?
Is there?
But yeah, I think I work in a smaller hospital, so it's like more family oriented, I would say. I mean, these women have delivered my babies. They've seen my vagina, like. So I guess it just clearly depends on the hospital you work at.
Yeah.
I work at. I feel like there's probably a lot of burnt out labor and delivery nurses. I feel like I see a lot of, oh, we need. They're short staffed. Not that every unit is short staffed, but.
But still, like, the short answer is no. Is every L&D unit toxic?
Right.
No.
No.
But the longer answer is there's more things going on than just like a toxic work environment. Typically, people are burnt out. That's the number one.
Yeah.
Which is not fun for anyone. But I also feel like if you're in a unit that is toxic, you need to leave it.
Yeah, I agree.
You have every right. I don't care if you've been there 6 months or 6 years, like you can leave it. Especially if you've brought things up to management or whatever and no one's doing anything about it, then yeah, that unit is toxic and it's time to leave. But I brought this up for Anna because she talks a lot about her unit and how it's not toxic and it's very much family like. You love going to work and not a lot of people get that, which is sad.
I know.
But it does show like not every unit's like that and it can be
great
and productive and
yeah. So it's out there.
quote-unquote
So
normal.
like Lindsay said, if you feel like you're in a toxic environment, leave it.
Yeah.
I mean, you have your RN license. Like you have so many opportunities.
Yeah. And most, and I know there's rural hospitals and whatnot, but most cities have multiple options. So I understand that again, there's like rural,
Right.
But you can leave it.
Yeah.
And even if you have to leave your specialty and go to a different one, you got to find one that works for your mental health and everything. So, because on the flip side of that, like you saying, I hear like L&D nurses are bitches. I hear ICU nurses are bitches.
Oh, that's true. I hear that too.
Like, ER nurses are bitches. Like it depends on who you are.
Wait,
but
I've never heard that med-surg nurses are bitches though.
They're busy working.
They're just angels. Yeah,
They're busy working. Too busy to be a bitch.
yeah.
Next question. Do you think critical thinking takes time to learn? Or are you just born with it?
Well, on labor and delivery, I mean, obviously, some people are better at critically thinking than others. It's just true. Like some people are better at certain things than others. But I will say, oh, absolutely, any specialty. I think personally, I'm speaking for labor and delivery. I do think you need experience to have that intuition. Like, honestly, I know it sounds silly, but it's true. But like just even the feel of someone's cervix, like you can tell that maybe they'll potentially go fast or like, no, that's a really tight cervix or something like that. So for example, on my unit, you have to be independently working. So training takes like 4 to 6 months to be independently trained as a labor and delivery nurse where I work. But you have to be working independently, like not off orientation for at least a year before you can triage someone. So going to the ER and determining, X, Y, or Z, not necessarily labor, but if someone thinks they're in labor, they come to our unit, but we go to the ER for other things. Like if someone breaks their leg or something like that,
and they're pregnant as well.
They have to be. Yeah.
Oh, I was like, girl, you be going down there for broken legs? That's crazy. Okay, I get it.
Yeah. So, for example, you have to have experience to go and assess that patient to determine whether an obstetric issue is ruled out. Kind of deal. So. Definitely, I think it takes time.
I do
and experience to critically think in a specialized area. Absolutely.
I do too. Same with ICU. I felt like a dumbass every single day for like 2 years. And I say that a lot.
Yeah, no, so true.
It took me about 2 years to not feel like a total dumbass. Like I'm still there a little bit. Like every now and then I'm like, how am I here? But critically thinking the skill of critically thinking it's a skill. It takes time, practice, observance, experience. It takes like a lot of
I remember
things.
thinking as a new grad the first year, I was so stressed out just because there's so much information that's being thrown your way. And it's not it's like in addition to learning all this information, because when I graduated nurse school, I had no idea how to be a nurse. I was like, there's no way I can take care of someone, especially like a mom and a newborn or whatever.
No, that scares me.
But I just remember thinking, oh my God, I'm so stressed. In addition to learning all these new things, you still have to have the personality and like show up emotionally for your patient, at least labor and delivery. Because I mean, I know, I mean, I see you have patients that are you can't even talk to, right?
Yeah, but there's almost always family.
Family. Okay, okay.
So you're still on.
See, this is how much I don't know about ICU and like
But
labor
that's
and
why I don't know
delivery.
about L&D. I'm
Yeah.
like, you do what? You put your fingers in a cervix? Which
Yeah.
obviously you do, but it's
Yeah.
like stuff I literally don't deal with.
Oh, I actually just learned that a lot of nurses in New York don't do cervical exams. I don't know why, but
Really?
anyways, so yeah.
The doctors do it, or?
Yeah, I think I'm assuming that maybe they just have a lot of teaching hospitals in New York, to where
Oh.
maybe the interns do it, the midwives.
Okay.
Anyways, I ran into
That's okay.
a nurse in New York, and she's like, "Oh, we don't do cervical exams."
Huh.
I was like, "Really?" She's like, "Yeah, a lot of nurses don't." Anyways, off on a tangent. Like,
That's okay. I have a small tangent to add to that. Have you ever done have you ever decompacted someone for fecal? I can't think of the
no,
word.
but I
Fecal
did
decompaction?
accidentally check somene's rectum instead of their
there.
vagina.
That's probably something I would do. First day on the job. What do you think? They're like, you're in my butt.
No, so here's the thing. I'll tell you the story really quick. I haven't even done a skit on this. I just felt like it was like sodomy. You know what I mean?
It was an accident.
It was accident. Yeah. But so she had an epidural, so she's absolutely numb. And I like to keep the lights dim, very dim, especially when someone's napping. But her baby did this weird thing with its heart rate, and then sometimes that means like the baby's come down more or something's happening. So I was like, let me go ahead and check you. And like in my opinion, there's no such thing as too much lubrication
Yeah.
when I check someone's cervix. Like
Yeah.
we're not trying to go in dry.
Right, that hurts.
And I just slipped into a different hole, and I was
Did
like,
you know right away?
well, I was like, first of all, this is a little tighter. And like, second of all, why is this baby's head? Oh, this is not head. That's shit. Like, yeah. I was like, oh. She didn't even notice.
She don't know.
But I took my hand out, took my glove off, and I was like, I'm so sorry. I went into the wrong hole.
Did you tell her?
Yeah.
What'd she say? She's
And
like,
she was like, I didn't even feel it.
She don't
I was like,
care.
I'm so sorry.
she's like, get this baby out of me. I don't care.
So yeah, and then I just checked her, and her baby did like she was almost about to deliver. So
That's
I was
kind
like,
of really funny.
I was like, oh my god, thank God you had an epidural. I'm so sorry. Like, anyways,
No, I think it's pretty funny. I mean, it's an accident. We all do things like that on accident. I'm
not-
sorry.
it might happen again. I don't know. Who's the accident?
Still an accident.
You're like,
The first time I took someone's temperature orally, you know how there's like a little like cap,
Sleeve?
a little sleeve.
yeah.
I put it in their mouth, and it wasn't like fully giving me like, how it's supposed to little dial. I'm like waiting for it to give me their temperature, and so I pressed the button. I was like, oh, maybe I need to
Oh my
start
god,
it
did
with
you
this
shoot
button.
it into?
Right down their throat, dude. They're fine. That's why I'm telling the story. They're fine. But I said, I'm so sorry. And they pulled it out of their mouth, and they were very mad at me. I was like, I don't know what I'm doing. That's my first, as a new grad, that was like my first day. I was like,
Oh, well, I could literally go on for days about my new grad stories. But so, no.
next question.
Yeah, next one.
Next question. How often have you seen nurses transfer from other units to L&D?
Oh, a lot.
Yeah?
A lot on my floor or at my hospital. Jeez. A lot of people from med surg actually transfer to labor and delivery. And I love those nurses because they know so much
Yeah.
when they move to labor and delivery from med surg.
Yeah.
So it's great. They'll float over if we're short staffed. They'll do like postpartum and then like get their foot in the door and then
Okay.
So a lot. I would say, gosh, the majority of the nurses that I work with started on med surg.
So there's hope out there for you med surg nurses.
Yeah, absolutely. Get your foot in the door, float if they allow that.
Yeah.
Be willing. Put your feelers out there.
Do they feel like new grads all over again? Because I feel
Yes,
like we lose
100%.
that.
Oh, 1,000 is a different specialty.
Yeah.
Like, again, I could never be an
normal.
ICU nurse. I mean, I could, but I'm just saying if I went, which I do float to ICU, which is insane.
Yeah.
And when we get anyone that floats to labor and delivery or is new, we train them as like almost new grads.
Yeah.
Like your training's like 4 to 6 months.
And it's normal.
Yeah.
It's okay.
Every specialty.
Yeah, you're not dumb. Like, you're not supposed to remember all this stuff. Like, oh, well, you went to nursing school, you graduated, you passed your NCLEX, but I don't remember anything about babies. I'm gonna tell you right now, I don't remember anything about it except maybe a high heart rate, something about that.
Right.
That's
right.
all I remember. So like, yeah, it's normal to start over, and it's normal to feel like you're starting over.
Oh, yeah. Especially if you do decide to go into labor and delivery from a different unit.
Yeah.
100%.
Because like
So just know.
we don't deal with that.
Yeah.
Do care plans piss you off like they piss me off? It's probably
Honestly,
different.
I almost even ignore it. In my head, I ignore
Me too.
them.
Me too.
Like there's a little thing that you just have to click on like a screen and
Yeah.
be like, oh, I did it.
And click done.
Okay.
But overall, like from nursing school, they're not the same care plans than they are like online on the EMR. It's literally like progressing, not progressing. Like it's really easy, right?
Yeah,
Same
it's
thing for
super
you, right?
Yeah.
Yeah, but they do piss me off because
It's just a waste of time.
it's a waste of time.
In my opinion.
In my opinion.
I don't know. I want to know who likes them and
Fight them. Oh, sorry. No, we don't want to fight them.
No,
but-
I would like to. There's two types of friends.
Yeah.
I just want to know their opinion, like how it helped.
Yeah. Maybe someone could let us know in the comments because
Yeah,
they
please. If you like care plans, let us know and why.
let us know why, and it better not be for infection control because I know that's not the answer.
Yeah. Right.
Anyway, what does a regular day on the unit look like?
Oh, so that's another reason why I love labor and delivery because no day is the same. Oh, I actually work on a labor and delivery and postpartum unit. Like, so we're all like integrated.
Okay.
So, I know some people are like labor and delivery nurses and postpartum nurses. I do both. So the beauty about working on a unit like that is, you know, I can either do postpartum or labor, but labor is my passion. Like, honestly, if I have to go to postpartum, I'm like, oh, can I take the labor patient instead?
You're a little sad.
Yeah. I'm
Yeah.
like, oh. But a typical day, again, you're either maybe doing someone who's in normal labor, maybe an induction, maybe dealing with a newborn, postpartum. Like, that's why I love it. There's no monotony.
That's really cool, actually.
It's great.
Because I feel like ICU there can be monotony. What was that word? I really liked
Monotony?
it.
Oh, God, now I can't.
Monotony.
Monotony?
I feel like there can be because we deal with the same type of patient population essentially. Like a lot of my patients are withdrawals from alcohol or drugs. A lot of my patients have CHF or COPD.
But I feel like, ICU nurses like that, though. Like
I do.
the calculated.
Yeah, because you know what to
thing.
expect for
Yeah.
the most part. I do, but I like them to be ventilated in the best way possible.
Yeah.
Oh, and not because like
You know your airway's good.
I know that airway's good, and I also won't get distracted from like when people talk to me when I'm like in my zone. I'm like, whoa, I don't know.
You're like, I can't deal with the
think.
personalities.
I can't.
Yeah, yeah.
I just can't think right. I'm so scared I'm gonna like titrate a drug wrong or I don't know, titrate something wrong to kill my patient that I'm like, shh.
Right.
Don't
I
talk
mean,
to
you literally deal with like the sickest people out there.
Sometimes, and so sometimes I'm like, please don't. Anyway, that's why I like a ventilated patient because then they can't distract me, and I
Yeah.
can do my best to keep
No,
them
I get
alive.
it.
You know what I mean?
I get it.
It's not that I hate people. I just, and okay, I probably shouldn't. Anyway,
Maybe you can edit that out.
maybe I don't hate people. I just get a little nervous when they start talking to me because I just want to keep them alive.
Your introvert is coming out.
It is. Oh, this is a good question. Poop during birth. Does everyone do it?
I would say a lot of people do it. And then like if they do, big deal. Whatever.
I wanted to bring this up because everyone poops. Everyone
Yeah.
poops. Every single person on this earth poops in some way, shape, or form.
Yeah.
And if you poop during birth, it's okay. It
It
It's
means
considered normal.
It's considered right in my opinion.
Yeah.
Like you're doing it right. You're pushing in the right direction.
yeah.
So I mean, if someone doesn't poop during childbirth, pushing, I'm like, oh, they must have just had a bowel movement before or something. It's not.
It's nothing to
literally
be ashamed of because a lot of these
I don't
questions,
even bat an eyelash when
Right.
someone poops.
none of us care. Like I will say, I want to speak for like 90% of nurses or healthcare workers that when you poop in any
Like literally,
fashion,
we're like, oh, good, you're
labor and delivery,
That's working.
Yeah,
Yeah.
ICU. Like one of our questions we ask,
You're like,
did they poop?
Yeah.
Have they pooped? Because we need to know if you pooped. So like if you poop during labor, good for you.
Yeah, no, it's so normal. And I will say if you're like debilitated by the idea of pooping on the table, you can always ask your nurse if she can give you an enema. But that doesn't even mean that you won't poop, just
Yeah,
saying. But
yeah.
like some people are like, please give me the enema.
Yeah.
I'm like, girl, that might not even help. But
Yeah.
okay, here you go.
Yeah.
But yeah, it just means you're pushing in the right direction. That's what it means.
Yeah. So it's good. It's good news.
Yeah, good news.
Because there were just like some people on there that I think are newly pregnant, haven't had a child yet, and they're just terrified of thinking about pooping in front
Well,
of
let me
their
just tell you,
nurse.
after your first child, you're not going to care the second time around. It's
That's what
like,
I'm saying. I'm like, really?
or like people are in so much pain at that point.
Oh, they're
Like
just
they don't
get
even
it out.
care. They
Get the
don't.
baby
Yeah.
out.
They were like concerned at first, but then like,
And then they're like, who
no.
cares?
Yeah. No.
Yeah. I also, along with that question, someone asked, how often do husbands or spouses or whoever's in the room with the patient as a family member, how often do they pass out?
Oh, I don't want to say often, but it does happen. I can't give you like
Yeah.
I mean, the 11 years I've been doing it, I
Handful.
probably like, no, I mean like 30 probably.
Is it just because they're not used to
It's
it?
all different. Like sometimes it's during the epidural, sometimes it's during her pushing, sometimes it's like right when the baby comes out.
Okay.
But I will tell you, I will never forget this one patient when her husband passed out. She said, he is literally doing the least but being the most.
I'm going to use that phrase.
So I was like,
Doing the least but being the most.
yeah, it was great.
Yeah, because she's the one pushing this baby out and you're the one on
Passes
the
out
damn
almost-
floor.
Yeah, like trying to give him medical help. No,
That's pretty
just
funny.
merely existing. I love it.
Side note, back on the poop, have you ever had a patient deliver while also being positive for C. diff?
Oh, you know what? I actually surprisingly haven't. Thank the Lord.
Thank the Lord
I knew, like,
for them
yeah,
and
everyone
just-
involved.
Yeah,
Yeah.
because it's, if you don't know, it's contagious for one. So other people, like even we could totally get it from you.
Oh my God. I didn't even, honestly, I've never even thought of that because it's never happened. I'm
Yeah.
not saying, I'm sure it has somewhere. Oh my God.
It'd be awful. It's just an awful feeling. Like, you know, I've actually had C. diff before and it's awful.
It's just squirt.
I can't.
Squirt.
Yeah. Why would I do that? I don't know. It's awful. So someone asked if they said
Oh.
asking for a friend, which makes me laugh because I'm like, oh
love
no,
it.
do they have C. diff in
Yeah,
their?
I'm sure it's happened, but luckily I've never had that happen, and I can't even imagine.
And again, like we're giggling, but
no, it's so fun. That'd be so fun.
it's funny because like we really don't care that you're pooping, and even if you have C. diff, it sucks for you. It sucks for you.
That'd be like having a hazmat during
It would be.
as a nurse.
It's like please, because
And then the
again,
doctor's like literally in
it's
between
right
your
there.
legs.
Yeah, I've never seen it before.
And the
I haven't
baby,
heard
and then
it.
I think about the baby, like the baby,
I don't want
that
the
poor
baby to
baby.
get C. diff.
No.
I bet they could that way. That's another question for another day.
Yeah.
Can patients eat before birth? I've always been told it's ice chips.
Oh, okay. So it all depends. Are you high risk in pregnancy? Or are you low risk? Do you go to a hospital? Hospital, doctor, everything is different. I hear a lot that I was only allowed to have ice chips, but like, were you high risk? Were you low risk? I will say that at my hospital, we typically have low risk mommies, and they're allowed to eat whenever. Just when you get an epidural, it's like clear liquids. So.
Yeah.
If again you have something going on like a high risk, like a magnesium drip, clear liquids because it's like a risk for C-section, and before surgery you can't have much in your.
That's what I was going to bring up.
Yeah.
It's probably anytime we stop you from eating or drinking, it is for your safety. Like it's the most frustrating thing because you're hungry. And I know myself when I'm hungry, if I don't eat every like 2 hours like a newborn, I am annoyed. I'm hungry. I'm hangry. But it's always for your safety. So it's like, there's a reason we're doing it. And sometimes it doesn't make sense to you, but it's at the end of the day, it's like for your safety.
Yeah.
So
I don't know. I guess I've never really heard someone say like for a fact that they couldn't eat and they were low risk
I see.
for labor, and I'm like wondering if there was something else going on.
Most of the time
I
it's
don't
high
know.
risk for something.
I
At
would
least that's
think
what we
so.
would assume.
That's what I would assume.
Okay.
And again, the policies, procedures, and stuff like that.
And that's another thing is policies from hospitals can be different across the board. I mean, even if they're like on the same street, they might do things differently based on studies and whatnot that they've done.
Yeah.
So
I would just, if your pregnancy is a low risk and you're literally just like going through labor without any medications, and I would just be shocked if they didn't let you eat, but You let us know.
Yeah.
Public, let
Yeah.
us know.
Keep us updated.
Yeah.
Pitocin. So many questions about Pitocin. Can you talk about it? Lots of comments of asking if nurses, quote, just up Pitocin without asking patients, quote, end quote.
So,
Give us the education.
this is what I do as a labor delivery nurse. Educate the patient about what we're doing, make sure they agree with it. Yeah. I'm not going to do anything they don't want to do. Absolutely not, especially when it comes to labor. And I tell them this is how often I'm going to increase it, every 30 minutes to an hour if you need it, if your contractions are still spaced out, and I will let you know when I increase it.
Yeah.
If you're sleeping, do you want me to wake you up and let you know I'm increasing it? They're typically like, no.
Right.
So I could see the monotony of maybe someone doing it often as a labor nurse and like not telling them or anything like that. But
just going through the motions. And
exactly, going through the motions.
it's not malicious.
Yeah.
That's what I was trying to get at. Like, it's not malicious. Sometimes even I can always relate it to like ICU. If I go in and I titrate a medication for a patient, I don't always tell them exactly what I'm doing. But this reminds me to keep talking to the patient and let them know what I'm doing, because then they have questions in their own mind or whatnot. But
right.
There was a lot of questions about Pitocin, and I don't remember anything about Pitocin.
Oh.
That makes labor happen?
It makes your uterus contract and hopefully
like,
put you in.
Dumbass.
No, and hopefully put you into labor. That's always the goal.
Okay.
Everyone reacts to it differently.
Okay.
I will say, as a patient, though, if you don't understand, I actually teach birthing classes at my hospital.
Yeah.
So I always tell my patients, if you don't understand something, or if they're not explaining it in a way you understand, or if you have concern, always ask questions. Like you should. I personally like to hear questions because, again, as healthcare workers, we get in the whole like medical jargon, or we'll talk about something that we think is like common sense or like so natural to us, but absolutely not to
someone else.
That's
something I like try to remember so hard, is that medical jargon is not general public jargon at all. And so, but like for me and you, we could talk about it and I would know exactly what you're saying. But yeah, explaining yourself almost, and like I always say, I like to explain myself as if I'm talking to a child. Not that the people I'm talking to are childlike, but that way they know for sure what this means. Like their 5-year-old child could regurgitate it to me in some way, shape, or form.
I absolutely think that at any point you're me personally, at any point you're in the hospital, because, for example, when I had both my children, of course, I'm an experienced labor and delivery nurse, but I wanted my nurses, honestly, to talk to me like I had no idea what was going on, because when you're in labor, you're in such like this crazy mindset of like focusing on your pain and all the other things. And, it's just nice to have that reminder, even though like it was my specialty. I'm like, just tell me, just educate me. I just need to hear it. And stuff like that.
It's just helpful. From a patient's point of view, how do I get the nurses to take me serious? That makes me sad. That makes me sad too.
So sad.
And I put this one in there because we kind of talked about it earlier in a different episode, but sometimes there are not very good nurses or doctors or RTs or physical therapy. You could literally throw any profession out there. They're not always going to be perfect. We're human too, and sometimes we're going through hard days. That doesn't justify being anything but like the best you can for your patient. So I don't know, when people ask stuff like this, I'm like, oh, that's sad that you felt that way, that somebody made you feel crazy, I guess.
I think you should just say it. Like, I don't think you're taking me seriously and I need you to.
Yeah.
Or something. I feel like this
switch.
I feel like that would trigger me if someone said that to me. Or even say something about my safety. Like I'm concerned for my safety because you're not listening to me.
Yep. That would be a light bulb moment
and
for me too.
And if a nurse doesn't, if you don't see a change, or you can always fire your nurse.
You can. You can. I mean, and if it is for your safety, it's for your safety. This is your hospital stay.
And I just couldn't see a good nurse being like brushing you off.
Yeah. I couldn't either.
I couldn't personally.
I couldn't either. And like you said, like ask for a charge nurse if nothing's being done to change their attitude or the way they're treating you, or not, or what's it called? Like
brushing you off.
Brushing you off. Yeah. Like not validating you. Then Ask for a charge nurse. Ask for a different nurse. You have that right as a patient.
Yeah. I think, like we said earlier, sometimes, I people can go through medical professionals go through the motion, but if someone actually like said, "Hey, you're not taking me seriously and I need you to."
Yeah,
I
it would
think that
break my
would
heart.
I think that would stop people in their tracks.
Yeah, it should.
Yeah.
Never
And
done
I
that.
think a lot of patients would be scared to say that, but you shouldn't.
No, you shouldn't be, because at the end of the day, it is your safety and
It's
your
right. Yeah.
concern. And yeah, it does make
So
me
just
sad though.
say
'Cause,
that.
yeah,
Speak up.
yeah, speak up for yourself. Are you trained for breastfeeding?
Oh, yeah.
I've always wondered that. Like, does
Yeah.
that
I
also,
don't
sorry.
I was just gonna say I don't think all labor and delivery nurses are.
Okay. Is it a separate certification or does it just depend?
So it's definitely a separate certification if you want to be like really trained in like lactation, but there are courses that we take. Every hospital is different. Those online modules.
Okay.
If you are baby, I hate saying this. I've talked about this before. So did you know there are hospitals that are baby friendly and hospitals that are not baby friendly?
You've told me this, but I didn't understand it.
Well, it sounds awful because when I moved hospitals, I went from a baby-friendly hospital to a non-baby-friendly. My husband kept saying, "Stop saying it's not baby-friendly. It sounds like you guys like hate your babies or something."
Kind of does. I'm like,
It
what?
does. But if you work at a hospital, so a hospital that is like certified as baby-friendly, it means that there are certain procedures, certain things that they have in their facility and the education that they give their nurses to support and promote breastfeeding.
Oh,
So they definitely have to take certain like courses that a hospital that wasn't baby friendly
oh,
would
okay.
take.
Okay.
Yeah.
That makes sense.
Yeah.
Okay. So,
Just depends on what hospital you
okay.
go to or you work at.
Okay. That makes sense. I've always wondered that, like, does she do that too? This might be a hard question. How to handle parents who clearly are not fit to be parents?
Okay, I'm not gonna lie. Like there are a lot of people out there that
Yeah.
are not fit to be parents. Like let's just get real. Not everyone should have a baby.
Yeah.
What's hard is that at that point, that is not my place to judge because I play a specific role as a nurse, and my role is to make sure you're getting taken care of and that baby's getting taken care of. Postpartum, obviously, if I see any interaction that I don't feel that the baby is in a
Safe.
safe environment, then I step in. But as far as you can't really necessarily 100% judge if they'd be a good parent, but obviously you could assume based
Yeah.
on all these things that they've done to this point. So at that point, I just put my opinions of that aside and take care of the patient.
What you can.
Especially when they're in labor, it's the one of the most vulnerable thing I've gone through, and I know a lot of women could say the same thing who've had children.
Yeah.
So it's not necessarily dealing with like people who I think would be bad parents. It's just taking care of them.
Yeah. No, that's a good way to put it. Because I also feel like you said, like, if you feel them or the baby is in danger, then there's other steps you can take. And at least for me, when I feel that with my patients, then the first thing is going to my charge nurse and or social worker.
Yeah, for sure. And I will say with my experience, if I have a parent who, whether it be a mom, it's typically if it's not the mom, might be the dad, but if a mom shows that she doesn't really care for this baby, it's really rare that the dad does, or if there's even a dad there. I definitely obviously pay attention, and I will ask, "Oh, can I take care of your baby?" And they honestly don't even care. Like,
Yeah.
and then I've had women just like walk out,
Really?
like well,
They're
I'm
just-
leaving now, and then we have the baby, and then obviously social services is going to get called before, and this is like extreme cases. you know?
Yeah. Yeah. But it can happen.
It can happen.
Yeah.
It happens. Yeah,
It happens. Yeah. Is that hard to deal with?
it is hard to deal with, but
But it's just kind of part of the job.
it's part of the job. Every part of a lot of jobs in healthcare, you're going to deal with, ups and downs.
Yeah.
I feel like labor and delivery is good, and it's mostly good, but when it's bad, it's like really bad.
Yeah. And just touching on this, like if you are feeling, you like try not to internalize it and bring it home with you, because there is only so much we can do for patients like that. We can call social services or whoever needs to be involved, but then at the end of the day, like we legally can't do a whole lot.
Yeah.
You know what I mean?
Yeah.
Besides like our job and doing our best when we're there with them.
Right.
So.
Right. And that's what's hard.
Yeah.
Because you don't know where that baby will end up.
Yeah.
Or how they're going to end up.
Yeah.
Or even like parents not necessarily have their baby taken away from them, but you think like,
how's this home life?
Yeah.
What's going to happen? Yeah. It's hard to not, I think that's why it's really good to be in the moment with your patient and do the best you can, because you just never know if you might be changing their life, like, you know, one little step at a time.
Absolutely.
Kindness goes a long way in our field. So yeah, I feel the same way though. Like you shouldn't internalize it and bring it home. If you can, like, leave it at work, because at the end of the day, there's only so much you can do.
Yeah.
Are there a lot of support services for baby and mom if needed?
I think it just depends on the community you live in.
Yeah.
And people should get educated. Not a lot of people are, in my opinion, are educated to the resources that they might have. So I feel that your discharge nurse as a labor or a postpartum nurse should guide you and let you know where you can call or what references you have.
Yes.
Because, I mean, there are a lot out there. You just need to know. But and it just depends on their community. Yeah, there are a lot out there, but maybe they're not necessarily in your community. So it's just kind of hard. But I do think that in the US, women postpartum don't get enough support.
Yeah, I could totally,
like at all.
I'm not a mom, but hearing my friends, my family, watching people go through certain things, I'm like, I would think there'd be a support group for that, or there would be a charity for that, or a government, whatever for that. But there's not a lot of times, and I'm like, huh.
Yeah. So basically, unfortunately, it's like if you don't even have stitches down there, they're like, all right, see you in 6 weeks. When I'm like, there's a lot that can happen in 6 weeks. So I always tell patients, if you feel like you need to, like the generic discharge paperwork, they're like, oh, we'll see you in 6 weeks if you didn't tear down there.
Yeah.
I say, if you need extra support, you call the office.
Yeah.
If you need to be seen sooner.
Yeah.
But it's hard because, like, especially I feel like women and moms, they don't want to accept the help, or like
they feel like they're a burden.
Yeah.
And you're not.
No.
It's part of it. Like, and as healthcare professionals, we should make you feel welcome and like able to ask questions.
Well, and then I always say, as a parent, I have 2 children, you are your most valuable parenting tool. You need to invest and support yourself.
Yeah.
Like, you have to be good for yourself to be good to your your kids.
You can't pour from an empty cup.
Yeah. Whether it be, especially if you have a newborn or an older child.
Yeah. No, good answers. So moving on to a different topic. This one might need a little trigger warning. We're going to talk about fetal demise or infant mortality. So that's this next question. Trigger warning, you guys. This episode contains talk of traumatic births. What is fetal demise? Do you know why it happens? If there's always a reason, if there's not always a reason, how to help the patient cope, or how to help the nurse cope that's dealing with it. Just pretty much, what is it and how do we navigate it?
Okay, so fetal demise is the death of the fetus in the womb after 20 weeks. Before that, it's considered an abortion.
Okay.
But like, people take that term, so abortion is just like literally a medical term.
It is.
Yeah.
Just a medical term.
Fetal demise after 20 weeks, where baby, essentially doesn't have a heart rate and they deliver a dead baby. This is very like sensitive subject.
It's very sensitive. I'll
like,
put
it's
a
really
trigger warning at the beginning too, because it's very, very deep.
So a lot of the times when we have a mom that had a fetal demise, she'll come from the office, but we already know, or at least suspect, that the baby doesn't have a heart rate. So if it doesn't, there's a process of, now we have to try to figure out how we're going to get this baby out. It's common and for women to just be like, just cut this baby out. But, we're like, I know you're not thinking correctly right now. Let's, we really want to try to have it vaginally, because if you want to have more children,
VBACs are harder.
Yeah, well, it can be. And I mean, it's just a major abdominal surgery. So, sorry, no, I'm getting off on a tangent.
It's okay. You can get off on tangents.
So it's it's not super common, but it happens, and sometimes you won't even get that experience during your training as a labor and delivery nurse, and you just have to like experience it for the first time when you're assigned it.
Yeah.
And it's really hard. But I will say it's a different experience as the nurse because you have your nursing hat on, and again, like you can't let emotions take over.
Yeah.
It's really hard. You just have to be there for your patient and make sure she's doing okay and you're taking care of her needs. And then obviously there's a lot of emotional support after with the mom, baby, and the whole family as a unit. I mean, we do a lot of things. Like we, as a nurse, you have a lot of roles. You have to call the mortuary, you have to call organ donation. You have, if the mom wants to keep baby for a long period of time, you got to put the baby on ice, or maybe some units have like cooling cribs.
Oh, okay.
To where, because it's essentially like rotting flesh.
Right. How do you cope with that? Because it's hard.
No, okay. So that's actually a great question. So I would say you have to come into it as you know that this is going to happen if you work on labor and delivery. You just know. Yeah. And if you truly feel you absolutely can't handle that, then maybe, I'm just being honest, maybe the job's not for you.
Yeah.
But I will say it is definitely different just hearing about these stories versus actually experiencing it and putting yourself in the position, because you totally like flip the switch of, oh my gosh, that's really sad. Of course it's really sad. Yes, absolutely. But to the role of, I'm a nurse. These are the things I have to do. These are the tasks that I need to do. I need to make sure that she's also safe, because there's also, after delivery, you worry about her bleeding. You need to make sure, in addition to making sure everything physiologically is going okay, the emotional aspect, it's just a lot on your plate as a nurse. But I will say, for me personally, I knew I could handle something like that. I knew that this was, that was going to happen in my career at one point or another, and it has several times. After the first one, you realize if you can handle it or not.
Yeah.
You truly can.
Yeah.
So, and then after the fact, after everything's done, I think it's really important to have your support systems in place, whether it be a friend or a significant other or a therapist, to talk about it if it truly bothers you.
Yeah.
Or if you just have to let it out.
Yeah.
And I also do think, working in healthcare, at least in my opinion, you see some things that make you really like cherish your life, and like how bad other people can have it, or the traumas and the really upsetting things other people have to go through. And it's really kind of like a slap in the face when you're like, wow,
this happens.
Yeah, this happens.
Yeah, I agree with that wholeheartedly. I think the first time I saw someone pass away, I wasn't actually even a nurse yet. I was in nursing school. I was taking care of someone in their home. I took care of several people in their home throughout nursing school, and he passed away, I would say, tragically that night. I couldn't get a hold of anybody. I was by myself with him, and I was very scared when it happened. And I will say that I knew right away that I could handle ICU, because I handled it with this dude, and it was like, death is going to happen in any specialty. It sucks that it happens in a specialty where I think we think of L&D as life. Like we're bringing life into this world, but unfortunately you can also have the other end of it too. And watch mother or baby pass.
Like I said, when labor and delivery is good, it's really good, but when it's bad, it's like really bad, because you don't like ICU.
It's expected, honestly.
Oh, okay.
I think.
Yeah. That's what, in my opinion.
Yeah.
But like in labor and delivery, like, no, you don't go there to die.
Life.
Yeah, you think of life, not death.
Yeah. So I think those are all good points. It's definitely hard to navigate, and everyone's different too. But for me, talking about it with my coworkers or my friends that understand it really helps me.
Absolutely.
A lot.
Especially because they're going through the same things as you or experience. So
it's hard to talk to a non-healthcare worker about it. So I would say talk to a healthcare worker or coworker. And then again, if you need extra help with therapy or counseling or something.
Yeah.
Yeah.
Great.
Good answers. Sorry, guys. That was kind of a dark part of it, but I feel like it's necessary to talk about because it's part of the job. Thoughts on home births or water births?
Okay, so I actually love water births. Every state is different. Every county is different. I used to work at a hospital where we would do water births all the time. And the hospital I work at now, we used to do water births as well, but then they took it away from us because there needs to be more studies shown to like show that there is a benefit for a baby. There's more studies done showing benefits for mom, like in labor. But anyways,
Okay.
needless to say, I absolutely love water births. I've always had good experiences with them. And I've done those in a hospital, always a hospital setting, controlled.
Yeah, I was about to say, can I say it's a controlled setting? And it is.
Well, I mean, yeah, if you need like super emergent care.
Right.
But you do have to be like low risk. Like you can't be high risk pregnancy, jumping in the water and giving birth to your baby in the water. But I think they're great. And if someone wants that and they're deemed that like they can do that low risk.
Worthy. No, I'm just kidding.
Seriously, I mean, it is like a privilege these days because everyone's like always
high risk.
There's always something's
going on.
Unfortunately. But home births, I mean, if it works out for you, good. I mean, I personally wouldn't do it just because like I need that epidural.
Yeah. I know.
But
I'm not gonna have babies, but if I did, I'd give me the epidural. Are you kidding me?
But I've seen like a lot of bad things and things go wrong quickly. But you know, if I support a woman on whatever she chooses, as far as her birth, I mean, obviously, if I see someone who has like major risks and they're like, I want to do a home birth, I'd be like, oh, girl, come on, let's talk about it. Yeah. So I mean,
whatever floats your boat, as long as it's safe for you and the babe.
Yeah.
All right, I like it. Does the hospital encourage patients to keep their placenta? This question was asked a lot, and I didn't understand it.
That's so funny. No. I personally never encourage anyone to keep their placenta. If you want your placenta, I will support you as long as you don't have like a raging infection.
Well, I think there's a misconception with some of the general public that we like to keep things like placentas and organs and whatnot and sell them on the black market.
Yes, 100%. People always ask me that, and I'm like, no, we literally like.
I'm not saying that doesn't happen.
Yeah, right.
Maybe, but like we don't see any of that. I would suspect that's like a third world country type thing.
I would think so, like some weird stuff going on.
Because when I see it, I'm like, what TV shows are these people watching? I've never seen that in my life. Not to say it doesn't happen. I clearly don't know. But the question I was like, what do you mean? Do we encourage you or to keep your placenta, or we encourage you to let us keep the placenta?
Oh, maybe they meant like, should we keep our placenta so they don't take it? I don't know. But I could tell you through my experience working in a hospital in the US, we literally either the placenta goes to pathology because there's some type of issue with it and they need to like test it, or they disintegrate it with all the other biohazard stuff.
Yeah. Okay. Because that's why I was like, that question came up a lot in your question box. And I was like, huh, interesting.
But yeah, if you do want to keep your placenta, this is what I suggest. Either have someone who's designated to take it home because it's rotting flesh. Yeah. That's what it is. I mean, rotting tissue. Yeah. Not flesh. But, or like we have to put it on ice. Yeah. So I always just recommend, if you truly want to take your placenta home, just have someone come and get it in like a little ice chest. Yeah. There might be protocols for every, like maybe it has to be in a biohazard bag or something like that. But
because some people like eat their placenta.
Some people like encapsulate it and stuff.
That's what it is. Yeah. Encapsulate it. I'm sure they don't just take a bite out of it.
Yeah. I have seen that. I've seen someone take a bite out of their placenta.
At the hospital?
Yeah. It was like a dad, and he just like, I was like,
being silly or okay.
Well, yeah. Anyways,
question, dude.
I was like, isn't that cannibalism? No.
Yeah. It's interesting. Interesting choice of things to bite. How often do birth givers choose horrible names?
Oh.
That just made me giggle because obviously, like,
Yeah.
Whatever name you pick, I guess.
Well, I wouldn't say it's often, but the one time, like the few times you do hear it, you don't forget it. You're like, wait, what?
You're like, all right,
Yeah.
inspiration from something.
Yeah. Like this is gonna be a good story. But I will say I never say anything negative about anyone's name that they choose just
Yeah.
because, that's their child's
It's
name.
not our
But
place.
like of course internally you're like, what?
Yeah. It's like interesting.
But it there's a handful out there for sure.
They're just questionable.
Yeah.
What's the craziest thing a partner and or mother-in-law has said to a patient? Because I know you have a lot of really funny skits about
Yeah.
crazy things dad said or mom or mother-in-law said.
Yeah, so there's a lot. I would say that's not the norm, but again, there is a lot and it doesn't, it sticks in my mind. It's a lot of not being considerate. That's basically what it is overall.
Yeah.
Like, oh, I'm tired, I'm hungry, or commenting about the way they're already mothering postpartum when they literally just had a baby, or they want to hold the baby, yet it's like,
Mom just had this baby.
yeah, like it's not your turn.
Yeah.
Like when you say it's my turn to hold a baby, I'm just like, she will decide that, not you.
Yeah.
Like just stuff like that. So it's a lot of like inconsiderate. And then the most horrible things I've seen is from dads that are not with the mom, like because you don't have to be together to have a baby. Like
Right.
like let's get real, we don't have to. So, but I mean he's there, and those are the dads who are like obviously way less considerate of her feelings.
Yeah.
because
And like what she just went through to birth a whole human.
yeah. So
I always find that interesting because I don't know if I could keep my mouth shut, I guess. I mean, I guess I would have to, but
no, you don't have to.
You
There are
don't?
certain things that I
I
say
guess like
you
you
could say.
advocate for the patient.
Yeah, let me just educate you,
Yeah.
sir. Like,
Sir?
when I say sir is when I'm pissed.
I would love to see you in that manner because I
Sir?
don't. I'd be scared because you're always really happy if you were like, it's almost like your mom using your full name. You're like, yes, okay,
Yeah.
shit.
Yeah, anytime I say sir or ma'am is when I'm like pissed.
That's when your coworkers are like, she's ready.
Yeah, and it's mad.
Okay. Oh, next question. What is something you wish? Nope. Sorry. One for that. Most unique experience you've ever had with a patient. I'm sure there's a bunch.
That's what I'm saying. There's a bunch because everyone's birth story is different. But I mean, I've had some really cool things. Like I've seen moms get acupuncture to help them in labor.
Really?
Or I've had a mom go home at 8 centimeters. You have to be 10 centimeters. I mean, 10 centimeters to push her baby out. Like she was like, no, I'm not in labor. Like it must have stalled. And I'm like, you want to go home? Oh my God. Look, let me talk to the doctor.
Damn, girl.
And they're like, yeah, no, literally, like this baby's like almost out, and she's like, I'm not in labor, I don't want to be induced, I want to go home. Okay, we can't force you to do anything.
Right.
So that was pretty unique. And she came back like 3 days later. She even called, she was like, I think I'm in labor. Like so calm.
3 days later though,
Yeah.
like I would think
Yeah.
it'd be then.
Right.
Okay.
And then I think it's pretty cool when I have a mom who wants to go all natural as far as like no pain meds, but she's like on a Pitocin drip and has to be induced, and she gets in our birthing tub.
Oh, yeah.
But we put a wireless monitor on her. It's just kind of cool. Like she's
Yeah.
determined, even though like there's a medical intervention, she's like determined to do
Like,
it as
I'm
natural.
doing it this way.
Yeah.
This is the way. That's
Yeah.
cool.
Yeah, lots of unique things in birth because like cultures are so different too. Like
Yeah.
certain things that they do postpartum. So
Okay. I like it. What is something you wish patients and guests knew about labor and delivery process? Like, is there a common theme you see where you're like, they don't know this until they're here or anything like that?
There's a lot, I would say, but overall, I always like to tell people, first of all, don't be too hard on yourself because labor is unpredictable. So unpredictable. Maybe you thought you'd go all natural and then you end up with a epidural.
Yeah.
People are so hard on themselves. Or something that I always preface to patients before like an induction process starts is that it can take a long time. Like you don't just come and have your baby. It could be like days long, and that's mentally and physically hard for mom
Yeah.
and like their support person.
Yeah.
So that's something like, I mean, when I think like instantly a
Yeah.
question like that.
Yeah.
But overall, just take it 1 hour at a time, I guess you could
1 hour at
say.
a
Like
time?
when it
Yeah.
comes to labor, because
You just don't know how long it
I
would be.
you yeah,
It's all different.
and everyone's different. Like I thought I would be prepared. I was a labor and delivery nurse for 7 years before I had my own children,
Yeah.
and I was like, that was way harder than I thought it would be.
Oh my,
Yeah,
I
because
mean, I
you
can
have to
only
experience
imagine.
it yourself.
That's why I will
Yeah.
not. I
That's why I'm
experience
not.
through my friends. I'm like, good for you, mama. You're doing great, mama. Love you from afar, mama.
Yeah.
Um, what keeps you coming back?
I think I honestly just think it's so fun.
Yeah, you really
Um,
love it.
I love it. I think it's a very intimate time. I always think you can either make or break a person's labor experience as the nurse because you're there with them
Yeah,
like the whole time, at least
yeah,
your shift. And like the
yeah,
doctor's just there at the end. And I just think it's fun. I
yeah,
think it's unique. I think it's fun. It's a different part of healthcare where we're not taking care of sick patients. At least I'm not a lot of the times.
yeah,
I'm not, I mean, there are sick labor and delivery patients,
yeah.
but like where I work, we're not.
They're healthy most of the
Yeah,
time.
so that's just overall it's just really fun.
Yeah,
And after a baby comes, it just like changes someone and like it's just life.
yeah.
It's unique, it's exciting, it's scary, it's just very vulnerable.
Yeah.
So, it's just fun overall. And
I
again,
like
every
that.
day is different.
Yeah. I
So,
like that because if I do go back to staff, I kind of want to learn another specialty. I love ICU, but also the death takes a toll on me after a while. I'm like,
yeah.
okay, I would like to see more life than death. And I feel like, truthfully, I feel like I don't. Even though death is a natural process and it happens to all of us, it's hard sometimes where I'm
Yeah,
like,
it's just so
I can get burnt out.
yeah.
Where I'm just like, this is hard to see all the time. And again, I really do love ICU because regardless, I can also look at it like I'm helping them pass peacefully with
Yeah.
dignity. And that's something I can be proud of. But
Yeah.
sometimes it's just like,
It's hard. I can't,
oof,
yeah. See again
yeah,
how I'm like I
we're
couldn't
just
imagine
different.
doing that all the time.
Yeah. Yeah.
Like I'm helping bring life into this world.
Right. And I'm
And
helping them leave. That's how I feel. I'm
yeah,
like,
yeah.
wow. I mean, and again, it's like something I get. I like it, but it can still take a toll on me. I'm
Yeah.
just like, maybe something different would be nice. A
Yeah.
little change of pace here and there.
Wait, would you ever do labor and delivery?
I would now.
Yeah.
As a new grad, I was terrified of labor and delivery. I
Yeah.
had 2 clinicals there. I saw 1 birth. It was vaginal, and I was so thankful for the patient for letting us in. She let like 6 students in, and
That's
one of them
so
was a
nice
guy.
of
And so
her.
many people are
Oh
like,
my
no,
God. Yeah,
which I
yeah,
understand
yeah. Yeah, yeah.
because you're vulnerable.
Literally, like
I
you're
don't want everyone to see my coochie hanging out.
yeah.
Like, what?
No, I get it.
I also think like I wouldn't want my husband to watch me do that, like even though like he's seen every part of me, but not like that.
Yeah.
And everyone's like, you literally don't care. Get
Yeah.
that baby out.
Yeah.
But it scared me, honestly, because I had never seen a birth. I didn't have a lot of like sex ed growing up.
Oh.
I was kind of traumatized, to be honest, just because
It can be.
I
It can be
didn't,
traumatizing. There's a lot
yeah,
going down.
I just didn't realize like blood flow down there, what it does to your vajiji. Like she big. Like there's a lot of
Yeah.
stuff going on down
She
there.
gets
She
swole.
gets swollen,
Yeah,
and
poor
nobody
thing.
told me that. And I was like, damn. Like, and this
Yeah.
mom was amazing. Her birth went so fast. Like I'll never forget it. It was like 3 minutes, I think, and it was her 4th child.
Yeah.
And it just push, done, happened, snipped the cord, put her out there. Like it seemed to me like 10 seconds. I'm sure it was longer than that, but I wasn't prepared. And so from then I was like, I'm not doing this. I will not go into L&D. Like I can't handle that. And I'm not like, I think our bodies are amazing. It was just almost overstimulation.
Yeah.
Like I almost was like
Yeah.
not available to handle that. But now after being in healthcare for a while and just like I see bodies, all types of alive and dead, but
Yeah.
like body parts every day,
Yeah.
where I'm just like, oh, it's just another thing. I could do it now. Just
Yeah.
not as a new grad. New grad me was
Yeah.
not prepared. It's like
Growth. You've grown.
growth. We've grown. Okay. A couple more questions. Any tips for new grads or new transfers? Which we kind of touched on it.
Yeah,
But
I
like,
was gonna say just the main things for new grads if you are really wanting to get in labor and delivery: internship, NRP,
Yeah.
fetal heart monitoring classes.
Cool.
Same with anyone transferring. Get your NRP.
Yeah.
Get your fetal monitoring classes, and then talk to your manager. Put your feelers out there and let them know that you want a job on that unit, especially if you're just trying to transfer to that unit.
Yeah. I feel like that.
Maybe float. Offer to float.
Yeah.
Float.
I feel like that immediately shows the manager too. Oh, they already got this?
Yeah.
Oh, okay. They went over here. And that was the last question.
All right.
We zipped through that.
Sweet.
So do you want to tell everyone where they can find you?
Oh, yes. You can find me on social media, TikTok, Instagram, YouTube, and Facebook. If you just type in
all of them,
Anna the nurse, it should pop up.
Yep. I'll put the links to her socials in the description. But thanks again for being on the podcast.
Yeah.
Again.
Thanks for having me.
Letting me come over here and do this.
Of course.
Okay, guys. Bye.
Bye.